Welcome to Bloodborne Pathogens Training. In this course, you'll learn what bloodborne pathogens are, how they spread, and what you can do to protect yourself and others from exposure. By the end of this course, you'll understand the OSHA standard related to bloodborne pathogens, key definitions used in the standard, and the characteristics of diseases like hepatitis B and HIV. You'll also learn how bloodborne diseases can infect you and the steps you can take to reduce your risk of exposure. If a disease is caused by a microorganism, it's generally referred to as a pathogen. These microorganisms fall into four main categories: parasites, bacteria, fungi, and viruses. Parasites can range from single-cell organisms to more complex organisms and include diseases like malaria and giardia. Bacteria include organisms like E. coli, staph, and salmonella. Fungi cause conditions like athlete's foot and ringworm. Viruses, which are especially relevant to this training, take over cells to reproduce and include diseases like the flu, measles, hepatitis B, and HIV. The first step in preventing disease is understanding how it enters the body. Bloodborne pathogens can enter through several routes, including breaks in the skin, mucous membranes such as the eyes, nose, or mouth, and through puncture wounds from contaminated sharps. Recognizing these entry points is critical for preventing exposure. Many workers face potential exposure to bloodborne pathogens as part of their job duties. This includes healthcare professionals like nurses, emergency room staff, paramedics, and emergency medical technicians, as well as law enforcement personnel and firefighters. Other at-risk workers include housekeeping staff, laboratory personnel, dental workers, morticians, and employees assigned first aid responsibilities. Even workers in laundry services or home healthcare settings may be exposed depending on their tasks. Bloodborne pathogens are microorganisms found in blood that can cause serious disease in humans. While there are many types, OSHA focuses specifically on hepatitis B and HIV due to their severity and risk of transmission. These diseases can spread through contact with infected blood or other potentially infectious materials, making proper precautions essential in any exposure-prone environment. Hepatitis B is a viral infection that affects the liver and is transmitted through blood and other infectious body fluids. Each year, hundreds of thousands of people are infected in the United States. The virus can lead to serious conditions such as liver damage, cirrhosis, or even liver cancer. While there's no cure, many people develop immunity over time. It's also important to note that hepatitis A is not a bloodborne pathogen and is typically spread through contaminated food or water. Hepatitis B can survive in dried blood for up to 7 days, which makes it especially dangerous in workplace environments. Early symptoms may resemble the flu and include fatigue, stomach pain, loss of appetite, and nausea. As the infection progresses, symptoms may include jaundice and dark urine. In many cases, individuals may not show symptoms for months after exposure, which increases the risk of unknowingly spreading the virus. HIV, or human immunodeficiency virus, attacks the body's immune system and can lead to AIDS, a life-threatening condition. Once infected, a person may not show symptoms for years, but the virus continues to weaken the immune system over time. While treatment options have improved, there's still no cure, making prevention and awareness critical. HIV progresses in stages. During the initial stage, a person may show few or no symptoms. In the second stage, the immune system begins to weaken, leading to swollen lymph nodes and recurring illnesses. In the final stage, known as AIDS, the body becomes unable to fight off serious infections. Symptoms can include fever, fatigue, weight loss, and other flu-like conditions, but they can vary widely between individuals. Bloodborne pathogens are transmitted through specific types of exposure. The most common routes include contact with infected blood through broken skin, exposure through mucous membranes like the eyes or mouth, accidental punctures from contaminated needles or sharp objects, sharing needles, and transmission from mother to child. Understanding how transmission occurs helps you take the right precautions in your work environment. Unbroken skin acts as a natural barrier against infection, but pathogens can enter through cuts, abrasions, blisters, or other openings. Exposure can also occur through the eyes, nose, or mouth if contaminated fluids splash into these areas. That's why protecting both your skin and mucous membranes is essential when working around potential hazards. You can reduce your risk of infection by following key safety practices, including proper training, using universal precautions, maintaining good housekeeping, and wearing appropriate personal protective equipment. Universal precautions mean treating all blood and bodily fluids as potentially infectious, regardless of the source. Since you can't always identify who may be infected, this approach ensures consistent protection. Personal protective equipment, or PPE, serves as a barrier between you and potentially infectious materials. Always wear appropriate PPE when exposure is possible. Inspect it for damage before use and replace it if needed. Remove PPE before leaving the work area to prevent contamination from spreading beyond the job site. Hand washing is one of the simplest and most effective ways to prevent the spread of infection. Wash your hands thoroughly after any exposure and after removing gloves or other PPE. Use soap and running water whenever possible, and if those aren't available, use an antiseptic cleanser until proper washing can be completed. In areas where exposure to bloodborne pathogens is possible, certain activities are strictly prohibited. You should never eat, drink, apply contacts, or smoke in these environments. These restrictions help prevent accidental ingestion or transfer of harmful microorganisms. All surfaces, tools, and equipment that come into contact with blood or potentially infectious materials must be cleaned and disinfected as soon as possible. Use appropriate disinfectants, such as a diluted bleach solution, and allow sufficient contact time to ensure effectiveness. Always wear proper PPE during cleanup and dispose of contaminated materials safely. Sharps, such as needles and broken glass, must be handled with extreme care. Dispose of them immediately in approved sharps containers that are puncture-resistant, leak-proof, and properly labeled. Never attempt to recap or reuse needles, and ensure containers are sealed before transport to prevent injury or exposure. Labels and color coding play an important role in identifying hazardous materials. Containers used for blood or other potentially infectious materials must display biohazard labels, typically in fluorescent orange or red. Proper labeling ensures that everyone can quickly recognize and handle these materials safely. Regulated waste includes liquid or semi-liquid blood, contaminated items that could release infectious material, contaminated sharps, and certain pathological or microbiological wastes. Employers must provide engineering controls, such as proper disposal containers and protective equipment, to minimize exposure risks. Employees who face occupational exposure to bloodborne pathogens must be offered the hepatitis B vaccine at no cost. While vaccination is strongly recommended, employees have the right to decline, but they may choose to receive it later if their risk changes. Vaccination remains one of the most effective ways to prevent infection. Employers must maintain an exposure control plan that outlines how to prevent and respond to incidents involving bloodborne pathogens. Any exposure should be reported immediately to ensure prompt medical evaluation and follow-up care. Employers are also responsible for maintaining records related to training, vaccinations, and exposure incidents. After an exposure incident, proper follow-up care is essential. This may include medical evaluation, testing, and documentation of the incident. All records must be handled confidentially, and any work-related exposure must be documented according to OSHA requirements. Ongoing training helps reinforce safe practices and reduces future risk. Following OSHA guidelines for bloodborne pathogens helps protect both workers and the people they serve. By understanding how these diseases spread, using proper protective measures, and following established procedures, you can significantly reduce the risk of exposure. Creating a culture of safety starts with awareness, training, and consistent action.